Noticing thinning hair? Here's something most people don't realize. Once a hair follicle has been inactive for about 2 years, it's gone permanently and not coming back. That is why early action matters. My name is Dr. John Schmidt. I'm a board certified family medicine physician and a Fortune Top 10 company health advisor. And today I'm going to break down the real science of hair loss, the causes, the treatments that actually work, and the new options that are emerging. So let's talk science. Your hair doesn't grow continuously, it grows in cycles, phases. The anagen phase is the growth phase. This can last anywhere from 2 to 7 years. And at any given time, about 80 to 90% of your scalp is in this phase. Next up, we have a period of rest. This is called the catagen phase. It's a short transitional phase and lasts a few weeks to a month. During this phase, your follicles shrink and the hair stops actively growing. Then we have the shedding phase, the telogen or telogen, depending on where you're from. That is the resting and shedding phase that lasts several months, about 2 or 3 months. And the hair falls out during this time to make room for new healthy hair to grow in. Some experts also describe an exogen phase where old hair sheds, plus the new one starts to push through. But regardless of how we describe it, the problem with hair loss is that hormones like DHT, nutritional deficiencies, and other health conditions can shorten the growth phase. This pushes more hairs into that resting and shedding phase earlier than they should. So over time, those follicles themselves shrink in a process called miniaturization. And if the follicle stays inactive for around 2 years, scar tissue replaces it and regrowth is no longer possible. So important to act early. For men, the number one cause is sensitivity to DHT, which is a form of testosterone. It shrinks the follicles over time, especially at your temples and at your crown. And for women, we often see some hormonal shifts that cause this. Menopause, postpartum changes, or even PCOS can change this because when estrogen drops, the hair loss loses some of its natural protection with the estrogen gone. So there's a number of medical conditions that play a big role too. Thyroid disease, most people know about that, iron deficiency anemia, and autoimmune conditions, for example, alopecia areata. Then there is stress. After a surgery, after an illness, after a major life change, cortisol spikes. It can trigger something called telogen effluvium, which is a very strange word, I know, but this is the sudden shedding of hair across the entire scalp. So even your nutrition really matters. So low protein, low vitamin D, zinc, iron deficiency can all show up as changes in your hair. So let's talk about some treatments. Okay. Well, a lot of people know about Minoxidil, Rogaine. This is the most proven option that we have out there for topical treatment. This is available over the counter as a foam or a liquid. Now, it used to be prescription. It works by increasing blood flow to the scalp and extending that growth phase that's important for hair. So it's important to note that you have to be really consistent with this medication, which is why most people fail. You have to use it 2 times a day without fail for most effect. And when you do that, studies show that it can slow down hair loss and promote hair growth in both men and women. Now, when we're looking at oral medications, men, Finasteride and Dutasteride are 2 big ones. They work by blocking DHT. They're effective, but they can potentially come with some side effects that you need to talk to your doctor about, such as sexual dysfunction or even gynecomastia, which is breast growth in men. For women, a lot of times we might use spironolactone. That's prescribed as an anti-androgen medication. And we often want to correct hormonal imbalances like your thyroid or estrogen deficiency, because if we fix these, it makes a big difference in hair growth potentially. So lifestyle is really important. This really matters. I've had patients improve their hair thickness just by correcting, let's say, iron, vitamin D, zinc, and their protein intake. Really remember this, it's important. Hair is made of protein, and if your body is short on the building blocks of protein, your hair will suffer as an effect, and it's often an early warning sign. There are some emerging treatments, PRP, platelet-rich plasma. It uses your own growth factors and injects it back into the scalp. But to be honest, results are mixed on that. Depending on the study, 50, 60, 70% of patients show improvement. Some other studies show minimal change, so it's really hit or miss. My personal opinion is it depends on who did the study. There's low-level light therapy and microneedling. These are popular recently. There's early evidence maybe they'll help trigger blood flow and growth factors, but the results are really inconsistent on those. Still a little bit too new to make a comment on. But what does not work? Okay, most over-the-counter shampoos do not work. Most oils do not work. Most biotin supplements marketed for hair loss, they don't have a lot of strong evidence unless you're actually deficient in biotin or iron. So in that case, they might work for you. When should you see a doctor? All right, well, if your hair loss is really rapid or patchy or comes with other symptoms like fatigue or weight changes or irregular menstrual cycles, it's definitely worth investigating to make sure there's not another underlying cause. Also, if you have a strong family history of hair loss, guys, sorry, you're going to start to see thinning hair earlier. So the earlier you get treatment for that, the better off you are and more likely you are to keep this up. So hair loss, to wrap it up, hair loss can be a symptom of health. There are many areas in medicine where timing is everything, and hair loss is one of them, because the earlier you act, the better your potential results. And remember, it's going to take you a long time to grow your hair back, probably 6 months. I want you to imagine this. If you shaved your head bald, okay, now you need to stimulate the hair follicle, which is a couple months, and it would take the time from your hair to grow out from shaving bald to grow back. So you're looking at maybe 6 months. If you want me to do a deeper dive on some of these other products for hair loss, let me know. If you found this helpful, hit the subscribe button, like it, share it with somebody who's